So first I would check my MAR and my orders, and then I'd go into the patient's room, wash my hands, put on sterile gloves, identify my right patient. I would assess the site. Once I assess the site, I would clamp my tubing. I would take my gauze, place it under, then I would discontinue my IV tubing, throw it away. Then I would flush 5 mils. Then I would teach my patient how to maintain, about rolling around, making sure it doesn't get snaked on anything, checking for phlebitis, and document my saline lock. So I'd start by checking my orders in the MAR, and then I'd make sure that the amount is appropriate for my age of my patient and the weight of my patient. I would get my medications ready. I'm going to be administering 1 ml of Dilaudid, and will dilute with 2 ml of normal saline. So I'll draw up my Dilaudid. Then I'll drop 2 more mils of normal saline. And I would put 2 mils of air into this and draw back, so I have 3 mils. Then I would go in, check my patient, remove my gloves, I would wash my hands, make sure I have the right patient by the 2 identifiers. I would assess my IV site, make sure it's okay and still appropriate. I would then take my normal, or saline, push. I'd push 5, make sure my IV is patent. I'd then push my medication over 2 minutes, and then over 2 minutes, then I would flush again. And then once I was done, I would discard all my materials, and then I'd monitor my patient for any adverse reactions, and check on my patient, then discard all my equipment and documents. Once I walked into my patient's room, wash my hands, put on clean gloves, make sure it's my right patient with my 2 identifiers, and that the discard of the IV is appropriate. I'll loosen on my tape. Make sure not to pull skin. Then I would withdraw the catheter. I'd immediately apply pressure for 2 to 3 minutes. I'd monitor for tenderness, swelling, redness, pain, tenderness, anything like that. After 2 minutes, I would apply a sterile dressing if need be, and I would make sure it's covered at least with a sterile Band-Aid or sterile dressing. And then I would document.